Good evening, everybody. Welcome to Channel 6. It's Kenny Fogle here with you now on Community Focus here in Nelson County. And this is a little thing that we're going to do that basically going to affect everybody in our viewing area. It's the Kynect program. And a lot of people may know what that is. It goes in with the Affordable Care Act. And it's a program to help people get on insurance that doesn't have insurance. It may be several different things. But I've got the what I call the guru here with me right now is Mr. Scott Cedarholm. Scott, you have been with the Kynect program, well, from day one.
Yeah, since they started, yes.
Since they started the program, and it's getting national reviews all over the country as one of the most successful programs. And like I said, you're where the rubber meets the road as a connector, that it's called. Basically, what have you seen out of what you've been able to accomplish in the last 3 years now?
This is the third open enrollment on that I've been in, and you're first. That's why you call me the guru, right?
That's exactly right. You've been my mentor.
But when we first started, we had no idea what to expect. And because we expanded the Medicaid program, many more people were able to get insurance that had never had insurance before, so we're overrun with these people. And then there were a few QHP, we call them, Qualified Health Plan purchasers. That means they can select from any one of the 5 or 7 plans that are available to them. And they get extra help in buying those plans so that their out-of-pocket expense is not too great. And we're able to do that. Well, that just takes a lot of time, So that's what we did the first 2 open enrollment periods. Now, each one of the program's insurance plans is only good for 1 year. So each year you have to renew that. Those people who purchased a plan last year need to renew the plan for next year. And we had one company which is no longer going to be issuing plans, and there's 50-some thousand people of them in Kentucky. So whatever percentage we have of that, those people definitely have to pick a new plan this year because theirs isn't available any longer. So then they decided that, well, we can just auto-enroll a bunch of people. Just let them roll over into the plan they have. What they didn't tell you is the plan they had went up by $50 or more, and the money you're going to get help pay for it went down by $20 or more. So you're going to wind up paying another $70 for the same plan next year.
If you're not paying attention, come January, you're going to get a big shock.
A big shock, right. And so we're trying to tell these people, you've got a list, I've got a list, all of our connectors have lists. Try to contact these people and say, we really need to get together and talk about your plans, plus the new people coming in. So that's one of the reasons we opened our big store up in Louisville. We were at the Mall St. Matthews up there, and it's open every day. You've been up there.
I haven't been there yet.
I've been there.
I got a couple weeks to go.
Right, and I've been up there. And so there are going to be a lot of people going there. You and I are out in our counties, the 8 counties that we cover, every day, several days a week. Talking to these people, new people, people that need to renew, people whose plans aren't going to be renewable because of the insurance company no longer being there. And we have new people coming in all the time. People's wages have changed, so they need to report a change. So it's a busy, busy time. And we only have until January 31 to get it done.
And a lot of people, it's just human nature, they wait till the last minute before they do anything. I mean, right now is the time to start thinking about it, but a lot of people will say, well, I've got till January 31st or the end of the year or something like that. And then all of a sudden they're getting a panic. But right now there's a time to need to call and start taking their time and looking seeing what's available. And again, it might end up with the same program they got, and more than likely they will. But again, they're going to be paying a little more than they are this year, and that's when the sticker shock comes in.
Yeah, this is true. Yeah, and we do have the phone number that they can call and make appointments with you or Jane to get to see them. Right?
Okay.
Shall we do that?
Sure.
Go ahead.
1-855-406-0059. So again, 1-855-406-0059. 0059, and you're going to get somebody, and you'll just tell them what you're looking for. You're looking to get in the Kynect program, and see if you quite. Well, you don't have anything to lose. I mean, if you call, it's all we're free.
Our services are free.
Yeah.
Right. And what the hook on it is, of course, if you don't have any insurance, you're going to get penalized. We have nothing to do with that. That's all federally handled, and the penalty is going to be pretty stiff. This next year, I think it's $3.95 a person.
2%, I think, or some of that neighborhood.
Right. Yeah. And so you don't get stuck with that.
Well, they'll get, I think they get, what, a 1095 from their employer to turn in their income tax to prove they have insurance. Because a lot of people are really confused about that. It's exactly how do you prove you have insurance, or the IRS takes care of that part.
That's right, the collections and the fines, right? Yeah. So we don't have anything to do with that. We can tell you that, yes, there's going to be a hefty fine if you don't have insurance. So you might as well plan now, say, okay, I can budget this much toward insurance. What can I buy for that amount of money? We'll put your income in there. It'll come back and say, oh, we're going to help you with so much a month to help you buy the plan. And then we can look at the plans, and you don't have to commit to do that. We can do that on the pre-screening.
Right.
Yeah.
And the thing is the Medicaid is an extremely good insurance for somebody that's never had insurance before. The whole theory is for people, I know people have been using for years, they'll go to the hospital emergency room, and that's basically their primary care.
That's right. Yeah.
Now the whole idea is to get them an insurance of some sort, and they can actually pick a real doctor and go to a real doctor's office, right. and get preventive care rather than care after the fact.
And let's just make it simple, a single person making $16,243 a year qualifies for the free Medicaid insurance. Now, if there are more people in the household, obviously the amount of money goes up and so on. But just to make it simple, $16,243. If you make under that, that could be young people just getting started, only working for a little over minimum wage, and they fall under that 16.2. Well, I don't need health insurance, I never get sick. But what if you're in a car wreck? You know, what if you fall off that ladder you've got? You can get this insurance, and it's free.
And the thing is, too, is it actually goes up for kids under 19. I know it goes up to something like 218%, I think, of the poverty.
K-CHIP program.
The K-CHIP program. Right. So there's so many programs out there. I mean, you come in and you put all this information in, and the computer basically will tell you what you qualify for.
That's
Medicaid, the
right.
K-CHIP program. It might be you might be just a regular insurance, or you may end up, if you make enough, you do pay the full premium if you make enough money, but it shows you right there on the screen the different choices you have.
That's right.
And you can compare as rather than just sort of throwing a dart out there.
This year I've noticed we have more plans available. And so, you know, and there's usually a plan in there that can keep your costs down. You are going to have to help us. You determine what you think I can afford a month, right? Then we can go in and see, with your help, what can we find in the way of a plan that'll fit that.
And there are some really cheap plans in there, but then again, you get some deductibles are up in the $5,000 and $6,000 range.
That's right.
So you're taking a gamble.
Sure.
There's no question about health insurance. You're taking a gamble. If you're somebody that goes to the doctor a lot, or somebody that knows they got a lot of medicine, you might want a plan that it might cost a little bit more as a premium, but the deductible's a little lower.
Deductible is lower, right. Right.
So there's a lot of things that goes into picking an insurance plan. I know a lot of people think, you don't think that much about it, but there's a lot that goes into an insurance plan that you really, behind the scenes, you don't think about.
And let's clarify something too, because you nor I are insurance agents.
No.
And so we by no means know all the ins and all the outs.
And can't recommend anything.
No, and we can't. We can show you this is the cost of this plan. This plan has X dollars in deductible. You have to meet that amount before they start to pay. Everybody should know that, right? But to get into specifics, I'm not trained to do that.
No.
So we would say, okay, here's my best judgment on this. I think this plan or this plan would suit you best, but it's up to you to make that choice, not up to me to sell it to you.
And a lot of questions people will ask are, does my doctor take this plan? And we could get on the computer sometime and take some time and look that up, but the easiest way is for them to call their doctor and say, do you take this plan?
Right.
So what kind of insurance do you take? And that's the easiest way of doing it, but we can't help.
Yeah. That's why everybody seems to think that we are the be-all and the end-all. We're not, because each recipient has to take some responsibility, and part of that responsibility is, one, paying the premium, and two, finding out if your doctor is going to take the plan you want to pick.
Yeah.
And so we tell them, I'm sure you do, I do, okay, fine, this is the plan we think that you're going to take, right? Okay, let's not buy it today, but let's have you make your phone calls, do your due diligence on your end to find out if your doctor is going to take it, right? And you call me back and we'll just go in and click a few buttons and you're ready to go.
And one thing we want to clear up to a lot of people, obviously, you know, there was an election earlier just a few weeks ago, and one of the issues in the election was the Kynect program, whether it was going to continue or not. But if you sign up for insurance this year, you're guaranteed all the way through 2016.
That's right.
I mean, it's definitely not going to, nothing's going to happen to you in 2016. After that, we don't know for sure.
Ball game's up in the air.
It's
right.
exactly, that's it. It happens. I mean, every state makes a decision. We've got a state exchange. Some people have the federal exchange, and there's two different things, although it's the same animal.
Right.
But we're getting into that. It's a little more complicated. But right now, basically, you know, as Scott mentioned, 138% of the federal poverty level, then you're going to qualify for free Medicaid. And if it's above that, then you and it goes up pretty high. I mean, you can make as much as $80,000 a year if you've got several people in your family and still qualify for some sort of help on your insurance.
Right.
So is there anything else that we need to let everybody know about? I know you said the open enrollment ends in January.
January 31 is the end of open enrollment. I think that phone number again, 855-406-0059, is an important one to remember. And they'll get a hold of an experienced person on the other end who can set up an appointment with Jane or Kenny or myself, and we'll try to meet with them and help them out.
Exactly. And if you want to Google it, just Google Kynect, K-Y-N-E-C-T, and it'll guide you through, and it'll actually show you, has a list on there of all the connectors and all the ways you can get a hold of somebody. And there's many ways. You can go through an insurance agent. Many of them are trained in it. So it's not just the Kynect program, but there's a lot of help out there. You can do it yourself. You can actually go online and set up your own account, go on there and do it yourself without anybody's help at all. But if you need help, that's why we're here. So, well, Scott, appreciate you coming in. I know you stay quite busy doing this, been doing it for several years now. So, and the reason I say the guru is generally every time we go to the meetings, you're the one everybody looks around to ask the questions is, can we really do this? Because you've been, it's easier when you've actually been out there and went through a couple of these and you know what you're doing.
Well, I'm glad to help anybody that's just coming on board, and I look to you for help as well, because I've come across some things that you've been able to help me with that have slipped my mind or I never knew, which is many things. Right? The older I get, the more I forgot. But yeah, now is the time to do it. Sit down with your family and make up your minds to get a hold of a connector or an agent and get this done. All
right. Well, everybody needs health insurance. It's one of the smartest things you can do, and it's the law. So basically, you want to get in touch. So again, 855-406-0059. That's the number you want to call in this 8-county area here, but especially for Marion, Nelson, and Washington counties. And we're in one of these counties every single week. Standing there waiting for you to show up. So if you want to find out what days, I know we're in Washington County every Monday morning, and Marion County every Monday morning, and Nelson County, I believe you're on Friday mornings, and I'm over in LaRue County on Friday mornings. So we're trying to cover 4 counties here right now. So if you need to get in touch with us, call that number, 855-406-0059. Scott, appreciate you being here, and keep on connecting.
Thank you again.
All right, thanks a lot. Scott Cederholm with the Kynect program. We'll be right back with more on Community Focus here on Channel 6 TV right after this.